Hi, my name is Amy Sholin. This is my first year as a TVI with Comal Independent School District. I still have 5389 to finish and then my internship to finish to be completely certified. So looking at the diagram of the eye here, we're looking at the front of the eye right here, which is the cornea. The cornea right here is the clear tissue at the front of the eye. I'm just going to take that off for just a second. And when we look at the part next, it's called the sclera, and that's the white part of your eye. That is what provides a protective outer coating of your eye. There's also a clear membrane that covers the front of the sclera and the inner eyelid, which is called conjunctiva. The next layer down is called the choroid, which is right here in pink. The choroid is the layer between the sclera and retina. It contains many blood vessels and carries the blood supply for the eye. The outer layers of the eye receive oxygen from the choroid as well. The area of the eye where the retina ends and the choroid can be seen is called the ora serrata. It's around here. The retina is the next layer, which is the innermost and most delicate part of the eye. Light has to travel through most of the retinal layers in order to reach and stimulate the layer of the rods and cones. The ciliary body is a muscle that is attached to the iris, right back here in pink. And the iris is the colored part of the eye. The iris is right here, so this particular eye is brown. And the iris regulates the pupil diameter depending on the amount of light that is entering. And so when you look at the pupil right here, you'll see that it's a hole. So you can't touch it. Back behind there. So there's the hole. And the next part is the lens right here, which is suspended behind the iris by fibers called suspensory ligaments, which are connected to the ciliary body as well. And this muscle is used to secrete aqueous fluid, which focuses the lens right in through here. Now, as you get older and time passes, the lens can begin to harden over time, and this can lead to cataracts. So we look here, cataract is a hardening of the lens, and it can cause different vision problems for you. The vitreous, which is the next part, is the part that is in through here, which you can't see. It's a clear gelatin-like body that accounts for about 2/3 of the volume and weight of the eye. As a person ages, the vitreous liquefies, which sometimes can cause floaters, which are those little like squiggly things that start floating around when you're looking at a wall or a different colored paper. Aqueous humor is produced in the ciliary body right in here, and is in between the lens and the cornea. So in between the lens and the cornea here is where the fluid is. It flows from this anterior chamber through the trabecular meshwork back in here before it enters the canal of Schlemm over here. If the canal becomes blocked, the lack of drainage can lead to glaucoma. So what happens is the pressure builds up in your eye and it kind of bulges it. And so when the doctor checks the pressure in your eye, they like for a certain range. And if your eye is not draining that fluid properly, they could put you on medication or different things like that to help possibly take the pressure off of the eye, which will eventually cause damage to the optic nerve. In the posterior portion of the eye, there is no purple dot on this particular model, but this is where the fovea centralis would be. It's the central portion of the macula and has the highest concentration of cones. Only at the fovea do we have 20/20 vision. The cones also detect colors red, blue, and green. The optic nerve, which is back here, is a bundle of fibers that carry vision-related impulses from the retina to the brain. So those are the different parts of the eye, and I guess when we're looking at a funny fact, or as long as I did work for an optometrist for about 15 years, I had never really understood the part where your vision doesn't come from your eye, and that you can have a completely healthy eye but not be able to see because your vision comes from your brain. So depending on the amount of damage that one might have to their brain would affect their vision. So one would think that I should know that information for as long as I worked for her. But this concludes our show. Thank you.